Now, Max, you touched a little bit about acne, and that was a question that we saw come up a lot in our pre-questions, and I'm seeing some here in the chat function as well. And so I know you talked a little bit about avoid, I call it the teenage aisle because I've got two teenage boys. But what would you say, besides avoiding the teenage geared products, what would you say to a woman in terms of treatment for acne, or why does this happen?
Yeah, so acne is a whole other can of worms. So acne, there are some very specific treatments, targeted treatments in particular, that can cause an acneiform eruption in the skin. And I say, so acneiform means acne-like reaction that can be driven by a couple of different things, but typically the EGFR inhibitors or the MEK inhibitors. The EGFR inhibitors historically used in colorectal cancer, and the MEK inhibitors historically used in melanoma typically do produce this kind of acne gone wild on people. And that you need medical intervention from. So nothing in the pharmacy aisle is going to help. Now, we also know that people with an underlying tendency for acne will have their acne come out when they're stressed. And that your body is going to be stressed, both physically and especially psychologically when going through the cancer journey. So if that's the case and you're not on one of these specific treatments that has acne as a side effect, then there are things that can be done, but I would encourage people to talk to their physicians, probably not necessarily their medical oncologists, but perhaps first their medical oncologists to see if this is a reaction commonly associated with the treatment that they're on. And if it's not, if they had an underlying tendency for acne and it's just flaring right now, talk to their family doctor or ask for a referral to a dermatologist, because there's lots of good interventions that we can do. And there are different types of acne. Based on the type of acne, there are different products and prescriptions to recommend for it.